Hello, dear viewers. Welcome to yet another episode of the Sober Drive. I'm Vincent as usual, and on this episode, we are privileged to have one of our therapists from Botabika Hospital, Mr. Eric, and it is going to be more of learning this session than ever before. We've been always promising you that we are going to have one who is going to be telling us things from the expertise perspective. So on this episode, we've been so humbled. Mr. Eric is here. Would like to thank you guys for always moving with us. We are aiming at seeing that everyone is able to receive this gospel about alcoholism and sobriety. We would like to thank you for subscribing to our channel, sharing our content, and moving with us. Without wasting any moment, I would like to welcome Mr. Eric to talk to us. Mr. Eric, you're most welcome.
Yes, good morning, viewers. I'm called Eric Kweviha. I'm a therapist, specifically occupational therapist, and yes, I'm a therapist who's been working with mental health, within the mental health fraternity for at least the last 15 years, and I think I'll be happy to share with you any knowledge around the discussion we have today.
Oh, you're most welcome, Mr. Eric. Today we are going to be tackling the issue of alcohol and the alcohol addiction and all that. Our discussion will be rotating around that. And, people always ask themselves, do we have anything we call healthy drinking, that someone is drinking in a healthy way?
Well, that's a very common question. I've been asked that question many times, especially in the communities. But I think what they normally call the hard truth, I think that's the word I can use, is that any amount of alcohol, it has been researched on that any amount of alcohol or substance that you use, pose you a risk, to many health complications and even mental health complications. So the best advice we give people is never to start. That is the best advice we give people. Otherwise, you put yourself at risk. I'm not saying you're going to have these issues, but you're more at risk than people who are not using, to getting medical issues and also mental health related issues. Some of them like cancer and mental illness.
Okay, so when will someone understand that I'm actually drinking too much, besides the other voluntary we've talked about that? I don't know, when will someone realize that I'm taking now too much?
Well, that is a very, not easy thing for people who are using to identify. I think many times the clients have actually told me that by the time they realize it was too much, it just crept on them. It's not easy for you to tell that now I'm getting there, but you find mostly, I think your loved ones complaining. That's the time when it starts clicking in your mind, or sometimes having issues with your bosses at work, or for the students having issues with your grades. That's when you start realizing maybe it's too much, because most time people use it for fun or sometimes to relieve whatever they're going through. So it's really hard for them to to draw the line when now they're crossing or they haven't crossed. So it's a hard one. I would say we might talk about some of the signs maybe at some point later during this discussion, but it's really hard for most clients to tell. Yeah,
I think we should dive into this addiction issue. Who are these people that are at more risk of becoming alcohol addicts?
So maybe that's a good way of putting it, is that many people drink. From wherever we come from, we are aware. We have many bars. There's someone was making a joke. We have many bars, more bars than hospitals.
Yeah.
But to be more specific, is that some factors make people vulnerable, or some people are more vulnerable than others to actually getting addicted to these drugs or even starting using them. But there's an approach or a model we use called ACEs. This refers to the early childhood experiences we've gone through. some people have been lucky that have gone through soft, upbringing. Then others have gone through really hard ones. So those we call them essays. They are called adverse or bad experiences growing up. Some of us, not me inclusive, but I say some people have actually been sexual abused when they were younger, especially to do with the girls. And then we've had people who have been physical abused. By physical meaning, there's physical harm to their bodies. And then we've had those that have been emotional abused, as like bullying in schools, being abused by your parents or some other people. When you're younger, it becomes more vulnerable or risky, especially to your mental health. And then we have what we call the neglect. Some children have been neglected, especially to do with physical neglect, like failing to be provided food and other necessities, basic requirements. And then there's what called emotional neglect. I've seen clients who tell me that their parents have never told you thank you in their lives. It was always work harder. This is not enough. You're stupid. You need to do. Your brother's not like you. Exactly. So there's a lot that these young chaps have gone through, and those are the things that actually put some people at risk. That upbringing that has been harsh, and to some extent also it goes to the family. We've seen families, we call them dysfunctional families, because one, you find young people having their parents divorcing. It's not an easy experience, or possibly one of them dying, or both of them dying. Actually, I have a couple of clients who have lost their parents as young as P3, you can tell the age, P2, and then they are taken on by some relatives who may not take care of them like their parents would. And then we've seen some having their parents imprisoned, and that causes a lot of stigma as well, where some of these clients, I think 2 clients have told me that they used to be laughed at school. Your father is a thief because he was in prison. Your father is a murderer. So that kind of experience, when you're younger, it's really hard. So now that makes you more vulnerable, to coping with those experiences, and then later in life, adjusting appropriately. So when you find most of these clients who end up in rehabilitation facilities or end up on the streets, using and abusing substances, it means that they fail to cope with or adjust some of those experiences. So now these drugs come in as a way of, relieving, that distress or that trauma that, they are going through. And some of those experiences also lead to mental health issues. And the most common one is depression and anxiety. Those two are very common. And to the extreme, sometimes they develop real severe mental health challenges that, they end up, visiting these facilities. So those are the people I would say are more at risk. But in a nutshell, I'll talk about one big word called suffering. So these clients, actually, they are those who start off, for lack of better words, on a good note. They start off because they're enjoying. They enjoy the drugs. Most of those young chaps tell me, no, for me, I had no issues. I was just enjoying. But when you use these drugs, now they are going to, as a secondary, cause, they are going now to put you in a situation that is going to make you suffer. You didn't start off suffering, but because of your use, you failed to finish school. You're falling out with your families. You're having health issues. So now that causes the suffering, then takes you through the cycle of using because of the suffering that was caused by the drugs. But even there are those who start off with suffering. I've had depression for a long time. I've gone through trauma for some time, and I've tried to cope with it. I've failed. But when I started using the drugs, it gave me that sense of relief at least. So then they get to use the drugs. So there's that concept of suffering in both ways. You might start without suffering, but the drugs would cause that. Or you may start with suffering and then the drug will leave you, but then you go through the cycle of relieving your suffering. So this drug is there to give you, in quotes, a normal life because of the suffering. Yeah, that's how I can put it.
There are families that have been suffering addictions, specifically alcohol addictions, that you're seeing maybe mom at home drinks, dad drinks, or even the grands who are drinking. I don't know. Is it possible to shift addiction to the next generation genetically?
Yes or no? though some people have done research around culture, I think have some pointers, but it's not very definite. But yes, look at some of our regions here. I think from the east, Ajono. You find I have friends who have grown up there, and they've grown up drinking with their parents. It's Ajono's culture. And then there are people who have families who used to brew alcohol for the within the village, and then they find themselves drinking, and it's in quotes, it's allowed. But I think where the families get concerned is when you start going through having the effects of using. And well, human beings are unique and different. You may find a family of 5 children, or the 5 children are drinking, and then 2 get addicted, and then the other ones don't. So there's that difference as well. Some factors that could be really personal, but then others can cut across, genes, family traits, and then other reasons. We cannot, tailor it on one factor, but there are many factors at play that might make someone more vulnerable than the others. Yeah.
Okay. So you've been talking about all this issue of addiction. How can someone get to know that I'm actually becoming addicted to alcohol use?
Like the way we started it off, like it's not that easy. One of the signs that people start getting is when they get concerns from other people. But even the other important sign is your emotional regulation and expression. Because most of the clients will tell you that they reach a point and there's a shift of friends. By that I mean, we are friends and we go out to play football, we go to church. But if I start using alcohol, any other substances, and you don't, you see me shifting to other friends who actually use. So that shift of friends is a very common one, because most of them use the word havafala. So they don't use drugs, they don't use shisha and all those substances. So that shift of friends is very common. But also, social withdrawal from family and friends, and start slowly. Someone used to dine with the family, you start wanting to have your breakfast from your bedroom because you're hiding, because the cigarette is going to smell, or the alcohol is going to, especially when the families don't drink. So you start to socially withdraw because you're hiding. You're hiding the smell, you're hiding, the red eyes. Some substances make your eyes change. So that social withdrawal is also very common. It even happens at workplaces, where you realize that you want to go very early at work, do your work, and then leave, or want to leave early, you want to sit alone. So there's that social withdrawal, not because you have a mental problem, but because you want to hide. Because there are some, mental health issues like depression that would, make you go through that experience. You're tired of people. You just want to be alone. But this is to hide. There's a lot of hiding around addiction. People get to the point where now they realize these people are just disturbing my peace. So I need to hide. So that social withdrawal is more to, let me just hide my drugs. Let me be alone. But they don't hide from their peers they use with. So they're actually intentionally trying to hide from people who keep telling them, stop using, you're using a lot. So I think that's another one. But to be more, generic, your functionality starts to drop. Your functionality, rather. So your social functioning starts deteriorating. How you relate with people, you're more irritable or frustrated by simple things when you're socializing. Your work, if you're working, you start getting, concerns from your supervisor. Small things. They don't start, on a large scale. Small things. Your report is missing something. That's not how you've been. Or you started coming late, even by 5 minutes. They start noticing those small changes.
There is a shift in the way you do things.
And then some start getting, physical complications. By that I mean, medical. Having, I'm falling sick because now they're not eating well. Most of the time they're using substances. And then the students drop in their grades. So those could be the signs in your functioning. If you start seeing that drop, it's this small, it's only your close friends or family members who are very keen on who you are would tell them. But at some point, it will be very obvious. You've dropped out of school. You've been, chased from one job to another. You're falling out of your friends. Some who are married have failed to manage the family. So there are those obvious ones. But those are the extremes when it has, reached that level.
Actually, I was interacting with one of the comrades, and he told me for him, by the time he realized that was becoming an addict, it was after experiencing the withdrawal syndrome that sometimes whenever he could not drink alcohol, he could not function, he could shiver, sometimes could lose sight. So things like that, I don't know, that stage, it is like the most severe stage now that you cannot do without.
It's true. Well, there are a series of changes. When you start using these substances or alcohol, these are not common things you've been using. It's like even a baby who has just been born. When they start eating any foods, their body starts adjusting to this kind of direct food. When I say direct, when they're in the womb, their mother first have to process it and then it goes to the baby. But now they start, the body starts adjusting to this new, foreign something or substance, can't be in food. So when you start using substance or alcohol, your body would sense this is not a familiar substance in the system. So it will start to react. That's why sometimes most clients would develop some kind of, they'll feel like sickly in a way. Some people vomit when they drink alcohol for the first time.
Yeah.
People who smoke, most of them have told me you would cough almost the whole day. So the body is trying to say, please don't. I don't like this. But of course, some of them don't listen to that, warning sign. So they would continue. Now, what the body does is now going to change to adjust to accommodate this substance. And when I say adjust, it's like there are two bricks here, and they're trying to force one. What do? We create space for it. Now, when you remove it, so that means the thing is going to collapse. So it's adjusting. Okay, take your alcohol, I'm adjusting.
Yeah.
You reach a point, you're using it, and you feel as if everything is okay. But the moment you start to reduce, after you've taken it for a long time, reducing the amount or delaying to take the next, the body is going now to react. I adjusted for you. Please keep it that way. So to take you through those stages, initially people use, curiosity. They're experimenting. I've seen, some people using. I want to feel, that curiosity that people have. You're experimenting, and then you try it out. So after that experimentation, there's what called the social use. When after experimenting, you start using because of social aspects. When there's a party, you want to use. When there's a wedding, you want to use. When people have come to visit at home, you actually want to use. That means you're actually using because of social engagement. Without any social function, actually you can even take 2 weeks, you're not using. When they say there's a party, then say, oh, then we can't use. So that's called social use. Now the problem comes here. When you're using socially, you start to realize that actually, wait a minute. Much as I was using when my family came around, there's a way I felt better
After using.
Leave alone the fact that it's a get-together kind of thing. And then there are those who would say, I felt different. I have a client who told me, I was using weed with my friend, just trying it out. The day I went to the studio to start writing my music, I realized I was more creative than before. Even my friends actually made the same comment. They said, this time I think they're called melodies, not music. They said, hey, this time your tune is better. So he started to realize that actually these drugs are making him to do certain things in a special way, or they're actually making him to feel differently, but in a better way, of course. So that's what now we call the emotional use. When I say emotional, it means that you're actually using because of how you feel. When you use and you have better, relics, you feel good about it. So you use because it makes you feel exactly
the second time and the third, whenever you're going to try to start using.
Exactly. Or at some point you realize that I've had depression for a long time, but when I use this drug, I felt better for the first time. But I've suffered with depression for some time. Or I've had anxieties, like some young men and ladies find it hard to socialize in public. But after taking it, I realize now I'm more confident. I make more jokes. So they start now to use it because of emotion. That's why at that stage, we normally call it the risky use, other than being emotional use. Risky because you're now using to cope. You're using to function. So we say now it's becoming a risky use because you're using it to function, which is very risky. You started using function. So that third stage from social, it becomes, we can call it risky use, we can call it emotional use, or sometimes we call it abuse. Because instead of treating the problem with normal, recommended treatment, you're using drugs to treat it. So you can even call it abuse. Like the way people abuse, over-the-counter medicines like Panadol. So then the last stage is what called a dependence. This is a stage when now your body has actually started, what I talked about, started adjusting to this frequent, drinks on drugs that you're injecting in the body. So when you reach that stage, is what called dependence. So now your body and your mind is going to become dependent on these substances. The more you reduce them or stop them, the body is going to react. Those are what called withdrawal effects you talked about. Locally they call them TACIs, the clients. TACIs or withdrawal effects. Vomiting, headache, shaking for take alcohol. Some people develop some kind of psychosis. They hear voices. Others develop insomnia. They can't sleep. But once they take the drug, they normalize immediately. So that means now the body is dependent. That's why you use the word dependent. But if all that fails and you continue using, you're going to go to the most severe stage, which you call the SUD, substance use disorder. You now develop a disorder or alcohol use disorder. So those are clients who have now failed to function totally. They can't manage their homes, they can't work, they can't study, they end up on the streets, others end up in prisons because they commit crime. These drugs wouldn't give you, they would affect how you reason out things. So your cognition and thinking is impaired. So you do things and then sometimes end up committing crime and so forth. So those are the stages. So by the time you reach there, actually, you've gone through some of these stages. Using because of curiosity, or then you start using because of friends. Then from there, I realize, wait a minute, without the friends, I also feel good. So I start using as an individual because of the emotional issues and, mental health related issues. And then etc. Yeah.
Oh, it is that severe.
Yeah.
Okay. So we've been talking about all these things, but someone would ask, do I need to be drinking on a daily basis to become an addict?
Well, it's tricky. I think what I would say, it depends on many factors. Generally, they normally recommend, but not in a more, scientific way. They recommend that ladies should take at least one per day. And if you look at how people drink, that looks like a punishment. How do you tell? Not one glass, but one bottle per day. That's what we call normally the regular alcohol. Maybe it has 5% alcohol. The drink itself, the way you see it, that's not the alcohol. It's like taking tea and then there's sugar. So the sugar that is there is what you put. So alcohol has some percentage in every drink. So some normal alcohol, let's say the normal alcohol has 5%, 5 to maybe 7 alcohol, like a beer, our beers here. And then you might go to maybe like the wines that would go, what you call the table wine. I think that's the word they use, table wine. It goes to maybe 12%. Then you go to the extremes, yes. That goes to 24, others 40, the most common ones in there 40. Alcohol. So you can imagine, a small bottle like this has more alcohol than a big bottle of beer. So the point is not how big the bottle is, it's the alcohol content in it. That's why these thought parts, they have more, they have more alcohol than even a big beer. That's why most people would resort, who are addicted, they hardly take beer, hardly. They resort to this small spirits, very small, but they after the alcohol content, not how big the bottle is. So, and it's very cheap. That's why it's easy for some people to get addicted faster. It's cheaper, but has more alcohol than even the other big bottles that are expensive. So for me, I like this. They recommend, and I'm saying not in a scientific way, that at women should take 1 per day minimum, which called the moderate drinking. Then the men 2 per day. So when you go to 4 for women per day, or in a certain occasion, we say that is binge. And I'm saying that is not very scientific. It's just because that's information that's out there to kind of make it look like, at least stop here. So 4 for women, we say that's binge drinking. And then for men, it's 5, 1 more, 5. But still, there are many other factors that come into play. For example, women who are pregnant, even I think a sip is not advisable. People who have, liver-related diseases, trust me, even a sip is not recommended. So there are many factors around it. But of course, like I said earlier, is that we just advise people against. If there's any way you can avoid, taking alcohol, you should, because you put yourself at risk of many challenges, mental and physical issues. Some clients would start using alcohol and they trigger mental disorder, which they were just vulnerable by genetics. Yeah.
Okay.
So it's always advisable, not to start if you can.
We've been talking about pregnant women, and I have just remembered one of the misconceptions people have, that when you take, spirits, they hope to clear the skin of the baby, the unborn. They hope him to come out with stronger bones. I don't know. How true is that?
There is a lot of information out there in the world. It can be rooted from the spiritual side or religious side, culture, social influences, name it. So, but we always advise people that always seek what we call professional support. If it comes to very sensitive things in our lives, it's not true that you're getting advice on which game to play. This is your life. This is your baby's life. So I think I don't think that information came from the hospital.
Yeah, it is not.
So I think the best thing, if you're dealing with health, then seek information from health experts. You're dealing with a health issue, and then you're going to your jaja, or you're going to some person, who's a very close friend in the village, who tells you, no, this alcohol does this. I think one of my family friends, let's call them cousins, she was, in quotes, told that when you take out of alcohol, it will cut your fats, belly fats. Trust me, she would make sure she takes Waraji. I think that was Waraji, almost every day, because she wanted to cut the fat. So my point is that that is not true, first of all. So the best thing is always to seek, professional advice or help if it comes to health. If it comes to social things, then seek social friends. If it comes to religious things, opening the Bible or Quran, go to those, spiritual leaders. But if it comes to health, the experts. So I wouldn't advise everyone to gamba around life, try things here and there because, Jaja said, or in our culture, this is what we do. Always be, more careful with health because sometimes you might get complications that may be hard to reverse. I may develop some, disability, or you might even lose your life. So that's not true. And alcohol actually does, affect the baby. Even when a mother drinks alcohol, the child or the baby, the fetus, is actually having a share of this. And sometimes we've had babies being born when they are withdrawing from the alcohol after being born because they're being introduced and used to this alcohol.
That is scary.
Yeah, it has happened. Yeah, we've had those fetal
You're withdrawing
issues.
before you're born.
No. When you're born, that means you've been cut off from supply, from mommy. So you also withdraw like, the adults do when you stop using, and then you have those withdrawal effects. So even this baby, after they've been, separated from the mother, so they also go through the withdrawal effects.
How do you tell the withdrawal effects?
No, the doctors can tell.
I think we'll need now to do a full episode about how alcohol affects the pregnant women. But we shall do that later. I would like us to talk about how long would it take someone to recover from alcohol addiction?
Actually, the word recovery is a big, concept. in the care of our patients here. And but to give it another word is to help a client to function again normally. You're helping them to function again normally. So that means, because when I was trying to define addiction, I said it affects your functioning. So one, we are trying to look out for sobriety. By sobriety, we're meaning a client stopping using these substances. And then later, to restore their functioning. Because there's no way you're going to restore your functioning if you're still using something that affected your functioning. It doesn't make sense. So that's why many times we recommend them to go into a facility where they're restricted from accessing substances. And then they go through some kind of treatment, which normally takes about 2 weeks, 2 to 3 weeks, which is called the detox. Now, after that, we are now trying to help you to now cope or manage the other underlying issues that made you vulnerable to using. If it was trauma, we need to address the trauma. If it was depression, we need to treat it. And then some of these drugs at some point actually do impair or affect your brain. So we need also to treat your brain. Because we're trying to treat you best. We tailor our treatment based on the things we've assessed and realized that you have these issues, and there could be a problem if we don't treat you. So recovery, that means it depends on the issues we've assessed and are associated with your drinking or the addiction. Like I said, the addiction may not be there alone, hanging in there, but it has these underlying issues, depression, pain. I had a client who had cancer, and that pain, using weed, weed, marijuana, used to help him, trying to manage that pain in addition to what was being given to him. So there's a lot to it than just the drinking. So because drinking is just a way of coping. So your recovery depends on many factors, but there's what we call the recommended time. So people only using alcohol, just been using alcohol, and they don't have these complications. Because now the complications would prolong your treatment. You're in a rehab or in a hospital, and you're being treated of alcoholism or alcohol use problems or disorder, but then you also have a liver problem. So that means you might stay longer because you have to also to manage the liver issue and then also your addiction. But you don't have much complications. It might take about recommendation, about 3 months.
3 months.
Yeah, those are 90 days. Is that good mathematics?
Yeah.
Are they 90?
90.
3 months?
Okay.
Yes.
Could be like 90, but normally they're 90.
Then if you're using other substances, then we might give you more time. Okay? Like 120. Okay? So, or more. Because sometimes we push clients to 6 months. Okay, so in between that, it depends on how the team is assessing you and addressing all your issues, as they come up or as they were assessed. And then by the time we discharge you, all we want is to make sure that before we discharge you, you're less vulnerable to using again. I think that's the key word. At the point where we feel from our assessment, alongside with the client, because they are part of the treatment, we journey together. We don't assume for them. We have an open discussion. Together with them, our observations, their feedback, we find that now this client is less vulnerable to using, and then we plan their discharge. But recovery is a long-term journey. We're just making you less vulnerable, then you go up in the community and continue strengthening your recovery. Okay? So I'm not going to say you're going to recover after the 6 months. So recovery is a journey. It takes as long as we can say it takes. So I've seen clients who say, I've been in recovery for now 4 years. You see, 4 years saying I've been in recovery. So it's something that becomes part of who you are, part of your personality. Recovery is my personality, so I need to maintain it. So it's not something that just happens after that period. So we only give you a momentum of you to now, take care of your life now. You have the tools, you have the skills. You know how to, to avoid triggers. When you go through challenges, you know how to cope with stress. Now go in the community, go work, go study if you're a student, go manage your family if you're a parent. So recovery doesn't have a defined destination, but it's a life journey. It's a life journey. That's what I can say.
I actually believe that it applies to all addictions we have.
Yeah.
It is very difficult for someone to say, I'm now completely okay from addiction,
Yeah,
because
exactly.
anytime you could get a trigger, and then you
and
have
then
to go back
relapse.
to the step.
That's
Anyway,
true.
on the journey to recovery,
Mm.
sometimes people face challenges and setbacks.
Mm.
In what you refer to as relapsing. What is
Mm.
relapsing?
If the symptoms of depression start coming back again, and that means, what do I think about? I know what used to work for me is the alcohol. So actually, a relapse, by the time you see someone using, they actually started relapsing way back. Because a relapse is when you start getting those things that made you vulnerable using. Because it's the one that relapse and then you start using. Because using substance is a way of coping with your issues. So that may relapse is the actual issue that made you to use.
It is not the actual going back to drinking. It is the problem that led you to drinking.
Exactly. Logically, people would say you've relapsed when they see you smoking again. But smoking is because I am coping with something. So we always want to advise, when we are trying to support our clients, we want them to understand that it is this vulnerability that's a problem. It's on the substance. If you get what I'm trying to mean.
Yeah.
So if this vulnerability is now coming back, and I've loved some of the clients who have actually told me, I feel the other feeling has come back. Before they drink, Musa, I'm relapsing. You see, they even identify like, I'm relapsing because if this feeling is coming back, trust me, I'm going to use again. So actually, the actual relapse to our clients is this vulnerability, this feeling, this suffering coming back. Because in many ways, the only alternative is going to go back and use. So without a vulnerability, you're okay. So for us, we tell people that look at that, what I call the core relapse is that. Then this one is what everyone sees. Your doctor would see, your parents would see that now azemo kunywa. But for our clients, it's that core factor, that bad feeling, that suffering. When it comes back, we need to address it because it's going to make you use again. So a relapse, in a real context, it's that suffering surfacing again. I went through a bad divorce, and then somewhere my counselor helped me to resolve it. I'm now okay. I don't need to drink alcohol. So I'm okay. Then I get into another relationship. But then this relationship, this man triggers the other feeling again. He slaps me. He abuses me like the other one did. So I get that feeling again. Now, when it comes back, that means I might use again. You see the difference?
Yeah.
So that means this client would say, I think I've relapsed again. The other feeling has come back. So for us, we don't prepare them by looking at you drinking again. We prepare them looking at that core suffering coming back again, because it makes you vulnerable. Remember what I said? We discharge you at the point when we feel, you and I mean the service user and the service provider, assess the situation to see that now you're less vulnerable. Your environment makes you less vulnerable. Your inner environment, your mood, your thoughts makes you less vulnerable. Then we discharge you. And then becomes a personal journey onwards. But if that feeling comes, before you drink, that feeling comes back again, can you call your counselor? Can you call someone who has supported you before? Because that is the core of a relapse before the other substance come in.
Okay.
Yeah.
Maybe as we wind up, how do you help people suffering alcohol addiction fight relapsing?
I'll use the word training. The word called life skills. Like any skill is training. So we might take our clients through rehabilitation, learn about the effects of drugs, which they know because they've gone through them, learn about different, drugs. But the most effective program is training you how to cope with difficult emotions, anger, boredom. Looks simple, but it has put clients to a certain level of their addiction. Some mental health issues, of course, there's treatment. Sometimes if psychotherapy, which they call it's not counseling, but it's what the general public refers to as counseling. Psychotherapy, psychologists, therapists talking to this client. That would, if that fails, there's also medication to the extreme, which is always provided by the psychiatrists or the doctors. So it depends. Like I always say, it depends on what's the underlying issue. But the most important thing is if we identify the underlying issue, and then we treat it, you become less vulnerable. But if you don't treat it, it's like helping a thief not to steal again. And then after helping them, they don't have a job, they're still poor. Yet they know how they used to steal. So they'll go back and steal. So the point is like, how do you make this client less vulnerable? That is the the concept behind it. It's not about restraining them in a rehabilitation center. No. So training is very key. How do you train them? How do you train a thief to make money without stealing? That's what I'm trying to mean. So how do you train this client to learn those coping skills? How to cope with disappointments, anger, stress, name it. Those who have insomnia issues, lack of sleep, and they suffer with it. So how do you help them to learn what called the healthy, or what called the sleep hygiene, learn the better lifestyles that can support their healthy sleeping. So it's about training and learning life differently. A client or an addict cannot go back and live a life the way it was. That in quotes can never happen, and then they can't use. They have now to live life differently. How do you do it? Empower them with skills, empower them with some knowledge that they didn't have that can support their decisions. And then sometimes I don't want to waste my time with, is the environment. Because when you empower a client, trust me, they're less vulnerable by the influences of the environment. Though, to some extent, some environment is very high risk, like going back to a bar, someone who was drinking alcohol. So sometimes we advise them that those situations, you might have to, forego them. But the best way possible is, how do you empower this client? Yeah.
Wow. Sometimes actually addiction comes from being powerless to fight some of the causes.
I think being vulnerable.
Mr. Eric,
yes,
would like you to call for action as we wind up to this episode.
So I think where I started from, I hinted on, grooming or raising children.
Yeah.
So I think we need to put more emphasis where we have children, schools, as young as primary. We don't need to wait when they're at the university. So how do we support them? How do we empower parents? How do we, maybe put up policies where children are, in quotes, protected, even from their own parents? It's a joke, but I mean it, because some children have been actually abused by their own parents. So how do we make sure that the children are safe in that environment? Because that's important. Some have been abused from schools, neighborhoods. So how do we make this environment safe for our children to have normal health, especially mental health, but also physical health? Because these are factors that make our children vulnerable. How do we continue, advising mothers to avoid using these substances while they are pregnant? Because sometimes they do it out of ignorance. Sometimes it's because they're already addicted. Even when they know, they can't stop. So how do we continue supporting so that we make our next generation safer, but also how to make sure the generation that we have is also safe? And that's why we are there. We're not treating those ones, but how do we prevent as well? Because in health, we look at more of preventive than treatment. As we are treating these ones, how do we put up policies or structures or systems in our communities that protect young people from using, but also that educates the elders from being better parents? Yeah.
We would like to thank you so much, Mr. Eric,
You're welcome.
accepting our invitation and speaking to us. It has been such an insightful discussion. Wherever you are, we would like to encourage you. Please, if possible, learn how to cope up with what Mr. Eric called triggers, such that you don't land into the problems of addiction. This has been today's episode, and if you liked this video, please subscribe to our channel and always share with colleagues that would be interested in this kind of content. We remain the Sober Drive, and for now we call it the episode.